Gastrointestinal diseases have been negatively affecting millions of people's lives for over 90 years. These diseases range from Crohn's disease to ulcerative colitis. In both instances, the body's immune system is compromised and attacks the natural bacteria in one's body, causing painful inflammation, diarrhea, and reduces the ability to absorb nutrients. These diseases are more commonly known as inflammatory bowel diseases. Inflammatory bowel diseases have resulted in over 35,000 deaths in 2010 alone, and those individuals with Crohn's disease have a reduced life expectancy. Inflammatory bowel diseases usually onset at an individual's 20s. However, it can occur at any age. Males and females are equally affected, and these inflammatory bowel diseases can infect any part of the gastrointestinal tract. There is no cure, and even though countless patients undergo surgery to remove the disease, it will ultimately reoccur and the patient will be diagnosed again. There are a wide variety of pharmaceutical medications available for individuals with these diseases, such as corticosteroids like prednisone, live biologics like Humira, and antibiotics such as Flagyl. However, all of these medications only treat the symptoms of the disease and have terrible side effects that will reduce the patient's quality of life and can introduce new diseases that the patient never had before. For example, prednisone has been used to treat gastrointestinal diseases since 1955. However, like all other medications for gastrointestinal diseases, it only treats the symptoms of the disease and contains countless adverse side effects that do more harm to the patient's health than anything else. Patients taking this medication will experience anxiety, weight gain, numbness throughout the body, trouble speaking, thinking, walking, breathing, mental depression, diabetes, a weakened immune system leading to new infections, and most important, loss of bone density, which eventually leads to osteoporosis. Another popular treatment option by gastrointestinal specialists to treat Crohn's disease and ulcerative colitis is Humira. Humira works by binding to TNF-alpha and reduces the inflammatory response in one's body. However, TNF-alpha is a vital component to the body's immune system. Humira drastically weakens it and makes patients very susceptible to infections. In addition, Humira has been linked to the development of lymphoma, and 35% of patients that take Humira develop the fatal cancer. Antibiotics have been used to treat gastrointestinal diseases since they were discovered in the 1930s. Most gastrointestinal diseases involve the patient's immune system attacking the natural bacteria in their intestines. Since Flagyl works at killing bacteria in those intestines specifically, they work well when the patient is on them. However, once the patient is taken off of them, the gastrointestinal disease will reemerge and continue to terrorize the patient. In addition, they contain unpleasant side effects such as headaches, nausea, diarrhea, and even seizures. Lastly, once the antibiotic has been introduced into the patient's system, the body elicits an immune response to it, and it will be far less effective if it's ever needed again to fight a bacterial infection or a gastrointestinal disease. Many gastrointestinal specialists are shying away from these harmful medications and looking to the cause of the disease to treat it and potentially cure it. Gastrointestinal specialists and researchers alike are looking toward prescription-strength probiotics, since they contain enough colony-forming units to inhabit and grow within the intestinal tract. They are enteric-coated to survive the stomach acid and have pH indicators that only release the product at the pH of the intestine. Therefore, researchers have been conducting clinical trials with prescription-strength probiotics, specifically VSL number 3, and the results have shown that these probiotics provide countless therapeutic effects. For example, VSL double strength number 3 is a probiotic that is only available via prescription and contains over 900 billion colony-forming units. It has been scientifically researched by the American Journal of Physiology, which showed that VSL number 3 can replenish a patient's natural flora, reduce inflammation in irritable bowel diseases, and maintain remission in patients with ulcerative colitis and Crohn's disease. VSL number 3 is now being prescribed by gastrointestinal specialists to treat Crohn's disease and ulcerative colitis. In addition, it has been studied in countless clinical trials. For example, in one clinical trial, 69% of patients were in remission after treatment with VSL number 3 2 times daily. All patients who went into remission maintained remission. There were no side effects experienced by patients who took VSL number 3. Furthermore, in another clinical trial conducted by the U.S. National Library of Medicine, 18 children with moderate to acute ulcerative colitis received VSL number 3 in 2 divided doses for 8 weeks, and the results concluded that the treatment of the patients yielded a remission rate of 61%. However, despite being available only via prescription, having successful clinical trials, and being recommended by countless gastrointestinal specialists to treat inflammatory bowel diseases, insurance companies will not cover the cost of the prescription. Therefore, patients do not use VSL number 3 regularly when they develop inflammatory bowel diseases. Most major insurance companies such as Horizon Blue Cross Blue Shield, Sigma, and others do not directly cover probiotic therapy as a prescription, which includes VSL number 3 double strength, despite being available only via prescription. Insurance companies will not cover it because they are not FDA approved. However, there is no probiotic on the market that is FDA approved, and many insurance companies use FDA approval as a preliminary guideline to cover a drug. However, probiotics are not drugs, and that is one of the reasons why they are not FDA approved. Furthermore, in 2011 of July, the FDA released its only statement regarding probiotic supplements. The FDA stated that the guidelines for what constitutes a probiotic food is that bacterial strains must be alive and active within the food in order to claim that the food is a probiotic food. However, the FDA does not mention probiotic supplements and do not specify any guidelines for what constitutes a probiotic supplement. Therefore, probiotics are not being looked at by the FDA for approval and are being unfairly categorized with other supplements in nutrition stores. However, insurance companies will consider covering the cost of VSL number 3 if they received a detailed letter from a certified physician explaining why their patient desperately needs the product. Only then will insurance companies consider covering the probiotic. Since a letter from a certified physician will persuade some insurance companies to cover the cost of VSL number 3, my gastrointestinal specialist provided me with the address of these insurance companies and encouraged me to try to persuade these companies to cover VSL number 3 for patients with inflammatory bowel diseases.